Hello everyone, I am Dr. Nikhil Agarwal. I have done my MD from King George's Medical University, Lucknow, and I will be taking you into the world of anatomy. So there are a lot of topics which I will be discussing in different headings. Okay, so first and foremost is the osteology part. In this osteology section, we will discuss about the skull, the mandible, and the cervical vertebra. Okay, so let us dive in and understand the things very clearly. First and foremost, as we know, for any bone in the human body, we need to discuss about the anatomical position. So how you will find the anatomical position of the skull? So there are two things. One is the Frankfurt's plane and one is the Reed's baseline. Okay, we need to know both of these things actually are passing from which point A and point B. Okay, so let us see one by one. Number one is the Frankfurt's plane. So Frankfurt's plane, you can understand both of them are actually converging at a single point, and that is the lower margin of the orbit. That is the infraorbital margin. We will discuss it eventually. Okay, and there are two different points. One is the center of the external auditory meatus and one is the upper margin of external auditory meatus, right? So number one, the green line which here it is representing, that is the Reed's baseline. Okay, and Reed's baseline is passing through the center of the external auditory meatus, whereas the Frankfurt's plane is passing above the margin, at the upper margin of the external auditory meatus. Then let us understand few things before we proceed further. So we are going to talk about the osteology part. So before that, above the head you have the scalp. Okay, so scalp, this layers which we'll be talking about eventually in the scalp and face chapter. Okay, that skin, connective tissue, S, C, A, L and P. Okay, epineuritic layer, then loose connective tissue and pericranium, and then we will have this bone, the skull bone. Okay, that is the which we will be discussing about. Okay, you can see in this another image, the scalp is shown and then you can see the bone. Okay, and this is having the external table, the internal table, and in between region with that is the diploe. Okay, so you should know the name, that is the diploe, right? You can see in this another image, same thing as per the previous image, but here the layers of scalp are also included. Okay, the SCALP layer which I just told you. Okay, now we discuss about the bone, that is the cranium. Okay, now you can look at this image. Okay, now before we dive in and understand, let us think about some basic concepts before proceeding further. The skull is actually consisting of 28 bones. Okay, so you need to know the names of the bones at least before we begin, because identification is very important from image based questions, right? So this 28 we can divide into two parts. Number one is the calvaria. Calvaria or the brain case. And number two is the facial skeleton. Facial skeleton, right? So each of them are actually having 14 bones each. Okay. Now what are these bones? The calvaria or the brain case, both of them are having some paired bones and some are unpaired bones. Paired and unpaired bones. Similarly, in the facial skeleton also we have the same list, the paired and the unpaired. Okay, so let us see what are these. First, in the calvaria or the brain case, the paired bones, we have the parietal, then temporal, and then the three ear ossicles, paired ear ossicles, which are the malleus, incus, and stapes. Whereas the unpaired bones which are forming the brain case, these are the frontal bone, the occipital bone, okay, and the sphenoid and ethmoid. We will be seeing them in multiple images. Whereas in the facial skeleton, we have the paired bones, which are the maxilla, then the zygomatic, then we have the nasal and lacrimal, palatine bone, okay, and the last but not the least, that is the inferior nasal concha. We will discuss in the nose chapter also about this. Okay, the inferior turbinate, basically that is an independent bone, please remember this. And the unpaired bones, what are? Very easy. One is the mandible, you already know, and the other one which you always forget, that is the vomer. Okay, so please remember, vomer bone, ethmoid bone in this category, and the three paired ear ossicles. So all these are MCQs which are oftenly asked regarding the nomenclature of the bones, at least. Okay, then let us see the images. See this image. I hope you know, when you are sitting and you can say in front of you there is a wall, that is the coronal suture. Okay, so you can remember this is the coronal suture, dividing the body into the anterior and the posterior halves, whereas sagittal suture is dividing into the right and the left side. Okay, so similarly you can see in this image the two major important sutures, and then the other suture, the last one, is the lambdoid suture. Okay, these things we will eventually see in normas, different normas. Okay, and in this image you can appreciate one very good thing, that is the differently colored bones. Okay, so these bones which are marked with different colors, they are important and you should identify them at least on any given section. Okay, so let us see this kind of an image. This is showing the view of an exploded skull. Okay, so let us take this in a three-dimensional view, okay, for a better orientation. So see, this is the skull, and you can see the different bones. That is the first one, you can see the frontal bone. Okay, you need to appreciate them from different angles, right? And then you can see this one is the parietal bone, right? Then this one, this entire bone on this area is the which bone? That is the temporal bone. Then here in this region, can you see here, this bone is the sphenoid bone. Just have a look. I will talk to you eventually in detail, don't worry. Right? What is this bone? This is the zygomatic bone, which you can appreciate in this image. Right? Then a very important bone in front, that is the nasal bone, you can appreciate here. And then a very important bone from dental point of view, this is the maxilla. Okay, this is the entire bone is the maxilla. Then you already know the mandible below. Then let us rotate further and see the other bone. This is the occipital bone. Okay, you can see the lambdoid suture, we will discuss eventually. So this is the occipital bone, right? And again the one bone on the side, this is the temporal bone. So please remember these names of the bones. Okay, these are oftenly asked to you in the exams to identify the bones at least. Okay, and if we take a exploded view of this skull, so you can see these different bones in the same manner. See here, this bone laterally, this was the temporal bone, right? So temporal bone, you can see, has very important aspects, the external acoustic meatus, right? And then you can also appreciate the styloid process which is running here. Okay, and then you can appreciate another bone on the side, that is the parietal bone. Okay, so this is an exploded view to understand. Then you can see this bone in the posterior aspect, that is the occipital bone having the foramen magnum. Okay, then the frontal bone here you can appreciate from inside also. I am showing you in a rotatory view. Okay, then very important, you can see this sphenoid bone. Okay, a butterfly shaped bone in the center. This is the sphenoid bone. We will discuss the different parts, right? And this is the maxilla bone. So this way you should remember the bones at least, okay, from different aspects, so that you can understand and answer different kind of MCQs. Okay, so I hope this image is very clear to you regarding the names of the bones. Now there are different aspects from which we can see these views. We can say the skull we are viewing from different angles. Okay, so these are the views: the norma verticalis, occipitalis, frontalis, lateralis and basalis. Okay, so you can see this in this image. So this view, first one, this one, the front view which you can see in this image, okay, of the skull, then norma frontalis, then you can see norma lateralis on the lateral side, then you can see the top view, that is the norma verticalis, then from behind norma occipitalis, and lastly from below, so that is norma basalis, and norma basalis can be interna and externa. Okay, so these are the different views of the skull, how we will see this. Okay, so let us proceed one by one regarding the different views. Right, so first we will discuss about the norma verticalis.